Our CEO, Mr. Deepak Datta, sat down with
I'm here with Dr. Jackie in Bangkok.
Hi, my name is Dr. Manapat Thaveeprungsiporn, or most of the people call me Dr. Jackie,
to reveal all you need to know about zygomatic implants in Thailand.
where sinus is falling down, there's no bone, or a lot of bone atrophy, the bone is thinning at the front part, there's no bone. So what we do is
What are zygomatic implants?
So usually a lot of cases where the patient has a movementization of sinus where sinus is falling down, there's no bone, or a lot of bone atrophy, the bone is thinning at the front part, there's no bone. So what we do is we need some kind of engagement for the implant and the bone. So usually what we do is we drew an implant further in. So usually it actually go through the parts here around the cheekbone, so you find the cheekbone here. So we pretty much engage the implant on cheekbone part, and usually it is more invasive.
You know, is Bangkok, Thailand a good location to come for the zygomatic implant?
In Thailand, zygomatic implant, it's not very common. There's a couple reasons behind it, because as a dental office here, according to regulation, we cannot do a lot of moderate sedation or GA. So, like for example, cannot do any ideation project aesthetic. So, a lot of cases with zygoma, you require to station because it's a more invasive procedures. But with zygoma implant, also another thing is also maintenance. For example, if zygoma usually you like the implant, it's gonna be much longer in comparison with a shorter. First thing first, if the zygoma fail, imagine them putting like 30 millimeters of implant there. The infection sometimes leads to other parts. And also remove an implant, let's say does the skull fracture a lot of sheep, it is very difficult to retrieve. Palatal approach implant, we place an implant on the palate of the patient, and we don't have to use that long implant. So we place implant right on the integral part of the palate. So usually the palate bone is very thick, so we place an implant right on that instead. So that's why we have zero rejection. Secondly, a lot of cases with the upper part of the jaw, the patient has what we call sinus movementization, where the sinus fall down and there's no bone. So we really cannot place an implant unless we do a sinus lift and bone graft on that particular area, which we cannot do an immediate doping where we place teeth next day, which is impossible. So what we do is place an implant, a technique that we use to Pterygoid. So Pterygoid is brought the bone right at the back of the jaw, upper jaw, and then usually the bone on that part, it is very dense. So right now you're gonna see a lot of practice using a Palatal approach and then Pterygoid macro. Because the reason is we use the same size implant that we use as a regular implant, which is that if something happened, it is very easy to retrieve. And then remaining part is just like a regular implant. But not all implant can be these kind of techniques. So the implant that are suitable for Palatal approach or Pterygoid is that. That's why to that. It's not just about the cost. Normal dental care, it's not appropriate for this kind of techniques or stone itself. So it's just a better. And then also we can do this under the local anesthetics because we don't actually have to do the cheekbone. So it is less invasive because with the cheekbone somehow we have to breathe through a sinus cavity and then do a cheekbone.
So Pterygoid or Palatal approach, how do you choose one over the other? So a lot of cases we have to be both. So Palatal approach usually is actually focusing on bone atrophy at the front, but Pterygoid is overcoming the bone obstacle at the back. So if the patient doesn't have bone at the back, replace Pterygoid. So if the patient doesn't have bone at the front, you use Palatal approach at the front. So usually it's a combination of two things. So we do Palatal approach the front and then Pterygoid at the back. Can you explain what are the medical conditions, dental conditions that this procedure is most suited for?
Okay, so mostly in their elderly, let's say 60s, 70s, 80s, because most of the time, let's say, especially in female patients, after they have what we call menopause, the bone regeneration process reduces significantly. Even though we do a lot of bone graft, the success rate is not that fast. So in this kind of cases, the best option is just to place an implant in the area where there's some bone already. So the predictability is much higher. So this is one of the condition where a patient has bone atrophy. Actually, we do a lot of this kind of techniques with Asian patient, Thai patient, because if we look at the anatomy, most of the time in Caucasian, the bone density and then the bone quantity is much more in comparison with Asian. So with the Asian population, Pterygoid and Palatal approach is more common because of the bone condition that they have. But obviously we can use in Caucasian, that's not a problem. It's just to do with the amount of bone in the patient. You also earlier in today's talk said that snap-on denture is another option for super seniors to have less moldings. So how would you decide between a snap-on denture implant type of solution versus this solution?
Okay, so with the over dentures, as I mentioned, we don't have to place 4, sometimes we place 2 implant. So in some case where the patient doesn't really have that much of the bone left and it is very close to the nerve, for example, so we place 2 implant from and then losing, that will be an indication for over dentures. And then also in some case where the patient has severe atrophy and they don't want people to like significant surgery, so over dentures is a best option, and they don't want to any kind of transition. That's very important. So some patients are wearing dentures for decades and they are happy with dentures. That's not a lot of patients. The reason why the patient wants to proceed with their client because the ill fitting the dentures.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.